You're listening to the UBC Medicine Learning Network.
Welcome. You're listening to Metamorphosis, a podcast where we interview physicians from BC and Canada with the aim of helping medical students navigate their medical careers. I'm Iman, and today we're joined by Dr. Yong-Hing, a radiologist based in Vancouver. She is also currently the president of the BC Radiological Society and Canadian Society of Breast Imaging, as well as a clinical associate professor at UBC. Welcome, Dr. Yong-Hing, and thank you so much for joining us today.
Thank you so much for including me.
I always like to start just by asking, how would you describe what a radiologist does and what your job is?
Okay, well, for the layperson, a radiologist is a physician who has done extra training in order to interpret medical imaging images. And those include x-rays, ultrasounds, mammograms, CT, MRI. And the other big part of radiology is that many of us perform procedures. So we don't only sit in dark rooms and interpret images. We actually interact with patients on a limited basis, but we do interact with patients, sometimes doing diagnostic procedures and sometimes doing therapeutic procedures.
Awesome. That's a great description. And I'm really looking forward to kind of learning more about the intricacies. And then I wanted to ask you, what brought you to medicine and what was that journey to actually deciding to be a physician?
Well, I resisted it for a very long time. Both my parents are physicians, and I really didn't want to go into pre-med after high school. So I went into engineering, mainly because all my friends were going into engineering. I had no idea what an engineer was. So I went into engineering, and it was like fun because I like math and physics and those kinds of things. But then I got my first summer job as an engineering student, and it was all men, and their lives seemed very boring. So at that point, I decided I didn't actually want to be an engineer. I enjoyed being an engineering student, but I didn't really want to be an engineer. So then I transferred out and I went into the College of Arts and Sciences. And all of this happened in Saskatoon at the University of Saskatchewan. So I did 2 years in the College of Arts and Sciences. I first decided that I would be an honors math major. And I'm very good at math. That's essentially how I got into medicine. So I would get like 100% on tests in math. And then I got this letter saying, come to the Department of Math to discuss your future. So I went, and again, it's all men. And they basically were like, yeah, you're not going to do math. I was like, how do you know I'm not going to do math? They're like, yeah, you're not going to do math. And I was very indignant. But then at that point, I was like, well, if you don't want me, then I'm going to switch. So then I switched, and I was an honors chemistry major. And it was very lonely because there are not very many of those. And I was in classes mainly with the pharmacy students. And I really hated chemistry lab. So I was like, why am I doing this? So then I decided, because then I didn't want to waste, I wanted to graduate in 4 years. I didn't want, with all my changing, I didn't want to lose any time. So the degree where I could use almost all the credits I had already accumulated without losing time was land use and environmental studies. So then I did land use and environmental studies, and I absolutely loved it. And my plan was to do that and then go on to Simon Fraser and do a master's in resource economics, and then hopefully work for the government saving the planet. So anyway, in that time, I also kind of was thinking, well, maybe I should apply to dentistry, because when I was a kid, I always said, well, I want to be a dentist. Not really based on anything that dentists do, but it seemed like a good thing to do. I have no idea why. So, and it was like an acceptable thing. Like everyone was like, okay, yeah, you want to be a dentist. So then I was going to apply to dentistry, and I picked up the form, and it said that I had to write the DAT, and the DAT was the exact date of a ski trip that I was planning on taking. So I was like, okay, well, I want to go on the ski trip, so I can't write the DAT. So then I picked up the form for medicine, and it wasn't while I was on a ski trip, and then I got into medicine. And then medical school, like unlike engineering, where I like being an engineering student, but I didn't want to be an engineer. I really hated med school. I really, really hated it. And I almost dropped out. I took a year off in between first and second year and did research. And I managed to get a research job. They had posted all the research jobs that were possible for the summer after first year medicine. And the only job that didn't involve like clinic or patients was this job where in medical imaging where you test software, and I like that idea. So that was the job I did, and then I ended up really liking it, and it turned into a 18-month project. So I took a year off from medical school and did this big project in MRI, and then met some really awesome radiologists. And then from that point on, I was like, I want to be a radiologist. But I kind of knew what a radiologist was, mainly because, really only because my parents were doctors and one of their good friends was a radiologist. And I don't think I would have known anything about radiology. I didn't learn anything about radiology in med school if that hadn't been the case. And so I, from that point on, was very focused, wanted to do radiology. And then that kind of made the rest of med school better because I was like, well, I'm not going to have to ask people about their bowel movements for the rest of my life. So then I got into the combined radiology and nuke med program at the University of Alberta. I moved to Edmonton and I did that. And then I ended up doing multiple fellowships. I moved to Vancouver and did multiple fellowships and got a job at BC Cancer, the Vancouver Centre, where I work now. And I also work in some community imaging clinics. And I'm the medical director of the BC Cancer breast screening program just recently. So that was the path. And it's a bit ironic because I kept not wanting to do things because of the boys club. And then I get into radiology, which is also a boys club. But I do really like radiology. And my big goal is to expose people who wouldn't otherwise be exposed to radiology. Because, as I said, I was very privileged. I recognize that. My parents were doctors. We knew radiologists. I was able to go and hang out in the clinic just because we were friends with them. My dad, who was ortho, would take me down to radiology when he was on call on the weekends, like from like the age of 4. Like most people don't get that exposure. So that I really do think that in general, medical schools, although it's better now, there really isn't much exposure to medical imaging and radiology. So I'm trying to work to change that.
Yeah, that's an amazing path. I love that I can't believe you did all those different things in 4 years. You still managed to graduate in 4 years. That's amazing. And I'm glad, you were able to just find yourself in the position that you wanted to, even though, like you said, medical school wasn't what you had maybe thought it would be. And then it seems like things have gone better after that. And then I did want to focus then a little bit on radiology, like the residency and how is it going through that? I think a lot of people don't really know what would be in a radiology residency and what that entails as well.
So the first year, like many of the specialties, the first year is basically a rotating internship where you do everything except for radiology. So you spend a couple months in internal medicine, a couple months in surgery, a month in pediatrics, cardiology, obs-gynae, like everything except for radiology. And then in PGY2, that's when you really get into radiology. And that's really your first year of radiology is your PGY2 year. And you start out by doing rotations so that you learn the essential things so that you can do call. So the things that you see on call are like strokes, pulmonary embolism, appendicitis. So in the first couple months of your radiology residency, you generally do those kinds of rotations so that you can be ready to do call after a few months. After that, then there's other rotations that you do. You do many of the rotations many times, and your experience is sort of different as you become from junior to senior resident in terms of what you do and what's expected of you. I personally felt like I had really good exposure to what radiologists do. I trained in Edmonton in the early 2000s. It was a very prosperous province at the time. So we had lots of toys, and we did lots of stuff. Because I was in Edmonton, the experience maybe is a little bit different for residents who come to Vancouver, because I've kind of noticed that UBC Radiology takes a lot of UBC students, whereas the Edmonton programs, many of the residents came from not Edmonton. So it was nice because everybody was from away, and so there was a great sort of cohort of people who were all, didn't know anyone else, and so it was actually very, very fun. So I made some good friends in residency.
That's awesome. Also, just to know, like, location wise, things are different between programs as well. And then you mentioned also that through that research project, you were able to kind of really solidify that you would like radiology. What was it in particular that drew you to the field that you didn't find in other areas of medicine?
Well, it was sort of a transitional period because I'm very old. So this was like at the end of the 90s. And it was a transitional period that kind of went up until even the early 2010s, where things were changing from analog to digital. And so in the late 90s, images were still generally printed on film. And so like an MRI would be put up, and all the little pictures would be there on the film, and you'd have to look at each one individually. Like, you didn't scroll, it wasn't on a computer. But our project was looking at software where you would scroll on a computer. And I just thought that was really cool. And it felt like that was going to be the future of radiology, which it evidently has become, that we sit here at computers and we scroll all day. And I like that. And I like the limited but not zero patient contact. And I like that we consult with other specialties. So we have lots of interaction in the day with people, but it's often with colleagues or the allied staff. Like, our technologists are key to us being able to do our job. So we interact with our technologists a lot, and the referring doctors. And then those of us who do procedures do interact with patients. Right before we started this, I was doing an ultrasound guided biopsy on a patient. They don't take all day. They're a short period of time. This person comes into my life for a short period of time. I provide a service to them, and then they go. But it's I like that. I like that it's not. I basically answer to that patient's doctor. So I like that.
It's nice to hear that, there's kind of, for people who might want some of that patient interaction, there's that available. If you didn't want that, you don't need that. Like, it sounds like you kind of build it the way that you want. And you also mentioned you had done fellowships after finishing residency. If you wanted to just go into, what you did, and how was that experience?
So the ones that I did in Vancouver were the VGH Emerge Trauma Fellowship, and that was great. It was all Emerge trauma patients, so patients coming through Emerge, and we did, the major traumas were always very exciting. You never knew what you were going to find, and that's what I loved about that. Like, honestly, had no idea what was going to be on the scan. It could be anything. It could be totally normal. It could be some weird congenital thing the person didn't know they had, or it could be some like acute traumatic injury that needed urgent attention. Like, could be any of those things. So, or a combination. So yeah, no, I really like that. And it was, stressful, but then when you're in this stressful environment, you generally bond with the other people in the stressful environment. So I also liked that. It felt kind of like a family. And then after that, I did diagnostic neuroradiology, also at VGH. And that was fun because we did procedures. So we did things like lumbar epidural steroid injections. We biopsied things. So there were, a number of things that we did that were interactive with patients. Also, just reading all the MRIs and CTs. That's basically like neuro And I had seen a lot of that, obviously, in residency, and then the trauma stuff when I was doing emergent trauma. But it was interesting to see it from the much more subspecialized point of view of the neuroradiologist, as opposed to the other sort of people I'd worked with. And then I did MRI at UBC. And that was also a really good year. During that time, I was actually working. So I was working as a staff radiologist in the evenings, on the weekends, on my days off, but I otherwise was a fellow. And at UBC, we did a lot of MS, so multiple sclerosis diagnosis and follow-up, and we did a lot of shoulders and knees and basic MSK MRI. So that was fun. And yeah, and then after that, during that year, basically I had agreed to do that fellowship as a favor to somebody. And I said, I'll do it if you get me a job. Because at the time, there weren't a lot of radiology jobs. And I did manage to get a job at BC Cancer during that time. So then when I finished, I came here. And I continued to work in the clinic that I had been working in, where I still work.
Yeah, awesome. Is that then doing, you've done 3, and now though it sounds like you do breast imaging, being, the director of that at BC Cancer, and also work in community clinics. Was that then done out of interest, especially the first 2, or was it to kind of find your footing, just to get a sense, like, is it common to do these fellowships in radiology?
It's very common to need a fellowship in order to work in a tertiary care academic center. Most of the people at BC Cancer have multiple fellowships. So I'm not, multiple people here, multiple fellowships. And they help us do this work here because it's really complicated work and it's all different parts of the body. In terms of breast, I had been doing breast in the community since I started working. And then I started doing breast at BC Cancer, largely because they didn't have enough people doing breasts. And I was mentored essentially since starting breast in the community. I was mentored. I basically checked every single case, although I was staff and I was signing them out myself. I checked with someone most of my cases for years. And then at BC Cancer, we do much more complicated procedures. But luckily, I had done all of that very similar work in residency at the Cross Cancer Institute in Edmonton. So it felt relatively comfortable. I took some specialized courses to get better at breast. And I, after you work for 6 months at BC Cancer, you get after you work for 6 years at BC Cancer, you get a 6-month sabbatical. So in 2017, I did a sabbatical where I went to multiple places and did breast imaging, and primarily breast MRI. So I went to the University of Ottawa Hospital. I went to Charité in Berlin, and I went to Stanford. So I came back with a lot of extra knowledge about breast, and I took on the role of the medical director of breast imaging at BC Cancer at our site. So it was a very intentional choice to do breast imaging. I still do body imaging, and all of those other fellowships really help with that. But in terms of the breast imaging, it's so rewarding, and there is way more patient contact than in just reading CTs or MRIs all day. So it's much more varied and way better.
Awesome. Yeah, it's great that you were able to find your path and kind of settle into it as well. And it just sounds like from your description of radiology is that it's a very challenging field to get to that expert level. Like, it sounds like it needs that much training. I feel like that's maybe something people don't consider when they think of radiology, just because they maybe think of it as just reading images. But it kind of sounds like there's a lot of work that goes into learning it.
Yeah, and radiology is getting more and more complicated in that you have to know all the diseases that all the other people need to know. You need to know how they're treated. You need to know what the natural progression is. You need to know all the anatomy. Like, you need to know a lot in radiology. And yeah, I mean, it's not really getting easier. The volumes are getting more. Nobody can do anything without radiology now. So, like, nobody goes to surgery without some type of imaging. So you do feel like you're a very key part of the healthcare system, which is also really nice. Yeah, but it does take a really long time. I think that the average number of post-secondary education years in to become a staff radiologist, not just at a academic center in a city, but just any radiologist, is 13. I did 17 because I did a bunch of extra fellowships, but 13. So yeah, it does take a long time, but as you said, you can sort of tailor it. And that's what's so awesome about radiology. It's so flexible, and it really is a good career choice for people who want flexible work. Like it's shift work basically. And there's not a lot of medicine where you can do very civilized shift work, a lot of it from home. Like, I mean, emerge is shift work, but you can't do that from home. You can do this stuff from anywhere. So yeah, no, there's lots of opportunity in radiology to turn it into what you want your life to be like.
That's super neat. I didn't realize that it was that concept of shift work as well. Can you actually go into, what a week might look like, for yourself? And then, if that's any different from like an average radiologist?
Yeah, so I definitely work more than most radiologists. So I work more than one full FTE. So my week is Monday, I work at one of the community imaging clinics. And then Monday night, I usually read screening there. And then Tuesday, I work at the screening program. So that medical director of the BC Cancer Breast Screening Program is an administrative role. It's not actually clinical. So I work in an office and go to meetings and write emails and offer my medical expert opinions so that the program can function. It's a team. It's absolutely amazing working there because there's so many great resources and so many people who can help you do your projects. So I do that on Tuesday, and then Tuesday evening, I then go to one of the other community imaging clinics and work until about 9 o'clock. And then Wednesday, Thursday, and Friday days, I work at BC Cancer Vancouver Center. So that's clinical work where I am now. And Wednesday night, I go to the clinic that I worked at Tuesday night, and then Thursday night, I do screening. And then Friday night, I'm usually cleaning up screening from the other place. And then Saturday and Sunday, I sometimes work in one of the clinics in the day. I often read screening mammography on Saturday and or Sunday. Sometimes I'm on call at BC Cancer. So just that the weekends sort of vary, but the weekends are generally more flexible in that one of the things that I really liked about radiology is essentially you have a pile of work and then you have however much time to do it. But like you figure out how you do that pile of work in that amount of time. And unless you are working in emerged trauma where they need the answer right away, you can do that work relatively. You can tailor your day for that work or the work for your day. It's as long as it's not acute stuff. It's very flexible. Like screening mammography, those cases are often generated, hours before, days before, and then you read them all. You bulk read them, like 100 at a time. So when you read that 100 is kind of up to you, and nobody's waiting for you to do it, or nobody's going to interrupt you. And so yeah, it's reading screening on the weekend is actually very, very relaxing.
So it sounds like you said, very flexible, kind of make your own schedule. I mean, it sounds like you're doing something different every single day. So I imagine it's also great for people who really want variety and don't want to feel like they're doing the same thing day by day too.
Yeah, I think that most radiologists have every day is a little bit different because you're put on a different rotation. So yeah, I think most of us have varied days, which keeps it interesting.
Yeah, I bet. And then I also wanted to go back to, you had mentioned that work, you work in the community, and then also at the BC Cancer, and you find the BC Cancer work to be more rewarding. So I was hoping if you could go into what are the most rewarding aspects of being a radiologist.
Well, the BC Cancer work is particularly rewarding because it's a small place It's not really a hospital. It's somewhere between a hospital and a clinic. And you develop really strong relationships with the referring physicians and even the patients, because the patients come back. And so you get to know people, and you get to know, the course of their treatment, and you're involved at multiple levels. We participate in multidisciplinary rounds, so tumor board rounds, where pathologists, radiologists, oncologists, radiation oncologists, and surgeons all come, and then we present the imaging, the pathologists present the pathology, and then there's a big discussion about treatment. So that kind of thing, it's a very collaborative environment, is rewarding. The clinic work is also rewarding in that it's more cut and dry. They're shorter cases, they're easier cases, they're way more straightforward. But the BC cancer cases are very complicated, and everything's kind of like a puzzle. So it depends what you like. Again, you just this would not work for a lot of people.
Right. And I guess that's where like residency helps, if you get exposure to everything and you can kind of see what aspects you enjoy the most.
And that's interesting also, because the residents really get no exposure to the clinics. The clinics are generally physician owned, and paid through MSP. So people call them private. There are private clinics where people are paying privately, but most of the clinics are community imaging clinics that are owned by physicians, paid out of MSP, much like a family doctor clinic. Those clinics generally don't have residents. So the residents don't get exposure to that work. And a lot of many radiologists, probably at least more than half radiologists, have some component of their work in a clinic. So it's kind of too bad that the residents don't get that exposure. Really, they're only in the teaching hospitals, which makes sense. And the clinics are more about volume, because they're so busy. There's so many people who need imaging. So that is one thing that could be improved in the radiology training programs, but it's a little bit of a big ask of the clinics to have residents there.
That's really interesting that there's a bit of that divide there. But like you said, you outlined some of the reasons that might be. And did you find then going through residency being like then primarily exposed to hospital settings, what's kind of the split like? Do people feel that they should be doing hospital work, or in your case, was it a conscious decision to not do hospital work anymore?
Well, the BC cancer work is essentially hospital work, even though it's not a hospital. So that's hospital work. So I do everything. I do OB, I do breast, I do body, I do neuro, I do everything. So I haven't actually made that conscious decision to stop doing anything, though most people do.
Okay, that makes sense. Kind of specialize a little bit as you get into the staff role. And I was also wondering what would be kind of the more challenging aspects of the field or being a radiologist?
Well, the pressure is always increasing in terms of volumes, and we do not have enough staff, and we don't have enough radiologists, but we also don't have enough technologists. So that is a cross-country issue, and we can't run our machines, we can't take the pictures without the technologists. So that can be really challenging, just the fact that we don't have enough staffing. Obviously, working in Vancouver, it's hard to staff the admin jobs. It's hard for people to live in Vancouver. It's just expensive. And so that is a constant challenge. And currently that's a challenge, I think, across BC. It's obviously different in different parts of the country, and over time it changes. So, in the late 2000s, there were not very many jobs, but now there's tons of jobs. But I do think over time, volumes are going to be increasing a lot. There has been some question about whether AI will take radiologist jobs. I don't think that's going to be the case. Radiologists are going to use AI to do their job better, probably do a higher volume to answer that pressure of the increased volume that's being required of us. So yeah, I think that a few years ago there was a fear about AI, and I think people are sort of understanding how it's actually going to help us. AI is going to be built into the machines, so that the pictures that we see help us find the cancers better, like that kind of thing. And yeah, so the volumes are always a challenge for radiology. I mean, the work is hard. That's just true. But yeah, that is one of the major challenges, is just keeping up with the wait lists and delivering the highest quality service you can with the resources that you have.
Yeah, so like you said, it's been a shift now that everybody requires almost, an image before doing most things. And you also mentioned for yourself, like one of your passion projects is trying to get people more exposed to radiology, as in students, trainees. And I know you also founded the Canadian Radiology Women. Do you just kind of want to go into that? Like what made you want to start that organization and your work in trying to increase exposure?
Thanks. Yeah. So, in when I was on sabbatical in 2017, I had wanted to explore creating a group for women in radiology. At UBC, I approached UBC leadership. They had no interest. They didn't think there was a problem. The thing that clued me into the need was that in 2016, UBC didn't match any female residents to the program. So in 2020, we didn't graduate any women radiologists. Yeah, so I was told that was a blip, that wasn't a pattern, that there were equal number of women and men in radiology, and it just wasn't an issue. And even if it wasn't UBC's responsibility to fix or address. And it was suggested that I go through the BC Radiological Society, and the BC Radiological Society was kind of like, yeah, this is not our problem either. I went to the Canadian Association of Radiologists. That's the big organization that represents radiologists across the country. There was also very little interest there. And I ended up doing a leadership course through UBC Sauder. And my final project was Canadian Radiology Women. So that's sort of how that was born. And that was in late 2018. And then, we just sort of plugged along in 2019. And then all of a sudden in 2020, George Floyd, the world decided that EDI was something they actually had to care about, or pretend to care about, whether or not they did care about. And then, things have kind of exploded. We started an EDI working group through the Canadian Association of Radiologists. We have an EDI rep in the BC Radiological Society. There's an EDI committee at UBC Radiology, and endless other initiatives that now exist. So yeah, that's what happened with that. And I mean, the main aim of Canadian Radiology Women was to support trainees throughout their training and then into their careers, so that they can sort of thrive in radiology, and, as you said, expose people who would not have otherwise been exposed to radiology, and allow them to connect with radiologists so that they can have conversations like this.
Thanks so much for also outlining kind of the path to get there. And I think sometimes we just see these organizations, so we don't consider everything. Like, it sounds like a lot of work to have gotten to that point, with everybody not being on board, and really important work. Have you noticed a shift, like in practice, when it comes to having more access to various groups into radiology?
Yeah, as I said, it's now recognized that you have to consider equity, diversity, and inclusion when you're hiring, and whether or not everybody is on board with that, they're sort of forced to be now. So I have seen a shift in practices that were very homogeneous becoming much more heterogeneous, which is great because that's better for patients. And that's the whole idea, is that improved diversity improves patients' care and patient outcomes. Um, Patients get the best care when the physician population is similar to their population. And yeah, so really having over 60% men really does not necessarily address the needs of women, right? So in general, I hope that's improving. I heard anecdotally that more women applied to radiology last year than other years. I think it's going to take a couple years to see if that sort of pans out, and if everyone stays interested in radiology and stays in radiology. But I don't think things look like they're getting worse, which is good.
Yeah, like a positive trajectory for sure. So that's good.
I hope so. Yeah. And like we've published now, we've published things to help the programs be more equitable, and some considerations in terms of their selection committees and their selection processes to hopefully make everything more fair.
Yeah, that's great. Like the behind the scenes work is really important as well to make sure that it's available for people too. And like you said, anecdotally, you've seen that last year maybe it was more popular. I think overall there has been a trend in that radiology is gaining more interest in medical students. Just like looking at CARMS data over time, is that something that you see on your end, like people reaching out? Do you have any idea as to why people are maybe now considering radiology?
I think that it sort of it goes up and down, just like the hiring kind of goes up and down, because it was very competitive in the 2000s. Like it was super competitive, and then it became less competitive, and I think people were kind of worried about AI. I did a number of find your match events with Doctors of BC where medical students can ask us questions, and the questions were always like, are there going to be radiology jobs in the future? And I really do think that that has become less of a concern. I think that the flexibility of radiology, and especially since COVID, where we do have the ability to work remotely and from home, and you know, a lot of doctors can't do that. I mean, people can have phone appointments, but we can literally like do all our work not here. So I think that that is really attractive to people.
Yeah, I think that like people are starting to consider that more seriously now as well, which is helpful. And as you mentioned, we do get some exposure in medical school, just incorporating radiology into the curriculum. But I imagine for people who are seriously considering it, what are some things that you would suggest that somebody who's really wanting to do it, and we don't get a clerkship radiology rotation, so what should people be keeping in mind if they want to actually consider it as a career?
Well, the advice I was given was just to go to radiology and introduce myself and say, like, can I spend some time here? And I think that's still a good idea. I mean, there's much more formalized ways for people to do rotations through radiology. I've had so many people reach out. You get the name of somebody, or you join a Facebook group, and there's somebody who says something and you can DM them. I've had so many people reach out through DMs, either on Facebook or Twitter, Instagram, where people are just want to do projects. So I think that there's nothing to lose by just reaching out. I've made some incredible friends, and I've had some very, very rewarding mentorship experiences from people who have literally just cold called me. So I say don't be scared to do that. Obviously, it is kind of scary. It's probably less scary just to text somebody or write them a DM. But there are also mentorship programs available. So use those. Join the radiology interest group. If you're a woman or you identify as a woman, join the Canadian Radiology Women Facebook group. You can also follow Canadian Radiology Women Instagram, Twitter, because we tell you stuff that's happening, and you can maybe connect to people through that.
That's great advice. Thanks. It's very concrete as well. I think just reaching out is like the first step, and it's great that there's so many people who are willing to also mentor students too. And now I kind of wanted to focus a little bit on some of your leadership roles. So, as I mentioned, you are the president of two kind of prominent societies of radiology. When did you kind of start getting interested in leadership, or was that something that you've always enjoyed doing?
So I just want to clarify, I'm the president of the BC Radiological Society, and I'm the president-elect of Canadian Society of Breast Imaging. And that's going to sort of switch in the fall. So I will be the past president of the BCRS in the fall, and I will then be the president of the Canadian Society of Breast Imaging in the fall. So, but for right now, I'm just the president-elect of Canadian Society of Breast Imaging. So I was lucky that there were people who were my champions and they suggested me for roles that I never would have thought that I qualified for. I didn't even know these roles existed. So that is really what got me into things, is people suggested me for roles. So, creating good relationships with people who can do that for you is really important. Once you're in a place where you can champion people, it's really, really meaningful. Like, it can change people's lives. So that's how I got into things. Literally, somebody suggested me for the BCRS executive. It's just, I would have nothing if people, I would have done nothing if people hadn't helped me and encouraged me along the way. Like, you can't do any of this on your own, right? I wouldn't be in radiology if I hadn't known radiologists. It's very much dependent, unfortunately, on people helping you. So it's really important. That's why mentorship is so important. Mentorship, sponsorship, championing, very, very important.
Yeah, completely. Like you said, it's really hard to get yourself to a place. Sometimes it's great because they can see things in you that you don't see in yourself, like you mentioned. So that's awesome. And for that work, is that stuff that you do outside of your clinical duties? Like, you have to find time? Like how does that work into your schedule?
Yeah, it's all volunteer, so it just makes your life busier. So you can't, I wouldn't do it if I didn't want to do it and I didn't think it was important. I just don't have time to do stuff that I don't care about. So I find that if you care about things, you tend to find time for them. But I do understand that there's lots of people who really don't have time, and that changes over your career too. Like, at some points, you might have more time than later, and obviously, if you want to be involved, people are probably looking for people to join these volunteer executives. Like, it can be hard actually to recruit people. And often what I find with women is they're like, oh no, I'm not qualified. Oh no, I couldn't do it. But nobody's actually qualified for the job until they leave the job. Like, so all these jobs, like, nobody's qualified for them. You get the job, you figure out the job, you move on to another job, and that's when you become qualified for the job you left. But then, so they've shown that women generally don't apply to things unless they think they're overqualified, whereas men apply to anything. So I suggest that people take that approach, and if there's something that they want to do, apply. And if you don't get it, it puts you on people's radars, and if something comes up in the future, they'll think of you.
I love that advice. That's really great. Just to kind of put yourself out there and see what happens, and you can always learn the job too, and people are more qualified than they think. And I also wanted to ask then, more so again, into like, as your career has progressed, like, was there anything that you wish you had considered more of, like when you were going through medical school residency, anything that you thought you only could learn after the fact?
Yeah, I'm very bad at reading. Like, I never really studied. I can't really study. That's why I got in with my math marks, because there was no studying in math. It was just like you understood it and then you applied the concept. And so that sort of is how it is for radiology for me too, is I need to understand the concept, and that helps me do the job. But yeah, I wish I was able to read and study, but I just can't. So I do also think that training programs should take into consideration these different ways of learning, because not everybody learns the same way. And I'm not sure if there's a shift in that, but I do think that would make a huge difference to increasing the diversity of people in radiology or in whatever.
Yeah, that's a great point, actually, that everyone kind of comes to medicine from a different angle, and so how they might learn it might be different, and so that's really important too. And then just to kind of end on a not even related to radiology, but outside of clinical duties and all of your work, what do you normally like to do? Like, what makes you feel fulfilled?
Well, I work so much. I have so little free time, but I go to Legree, which is basically brand name Pilates. I have recently taken up pickleball like everybody else on the planet, but it's actually very fun. I'm now a weird pickleball evangelical person, like trying to get everyone I know to play pickleball with me. And then I learned that that's like a meme. I'm essentially a meme now. Uh, so yeah, and pre-COVID, I would have said I love traveling, but that has decreased a lot since COVID. But obviously, I would like to. Though I think that that's going to become harder and less socially appropriate with climate change, and our awareness and our sense of responsibility in terms of our carbon footprint. Like, I don't think that it's going to be as easy or socially acceptable to travel in the way that we used to. I cycle. I do the regular.
Mm-hmm. Yeah, no, thank you for outlining that as well. Like you said, it's hard to find time, but even if you have a couple things outside of work, then I'm sure that that's great as well. Was there any last parting words of advice or wisdom that you wanted to tell the listeners?
Well, I honestly just reach out to me if you're interested in radiology, or if you're, I guess across the country, you can reach out to me. I can connect you to people at your site. Yeah, I've had so many different requests. Like, I had somebody reach out and say, do I know any female Black radiologists? And it took me a long time to find a female Black radiologist, which tells you we need more female Black radiologists in radiology. And connected them, and the person who asked me is now a radiology resident, so I feel really good about that. So yeah, just reach out with whatever weird question you have. I will try and help you. If I can't, I will find someone who will help you.
Thank you so much for your openness as well, and all of your work to get people more interested into radiology. I'm sure lots of people will benefit from every kind of help that you've given them. So, and thank you for coming on the show.
Well, thanks so much.
For more episodes of Metamorphosis, look for us on Spotify, Apple Podcasts, or wherever you get your podcasts. Thanks for listening, take care, and catch you on the next one.
This has been a presentation of the UBC Medicine Learning Network.